welcome to our podcast, where we dive into stories that inspire, educate, and spark reflection. And today, I, Ishika, have the incredible honor of speaking with a distinguished personality who not only restores vision but also brings light into the lives of hundreds through his service. Dr. Neeraj Pandey, a distinguished ophthalmologist and a true humanitarian. Sir is not just a medical professional, he is a visionary in every sense of the word. His work has helped people see the world, quite literally, and in doing so, he has helped communities rise with dignity. Welcome, sir, to our podcast.
Thank you.
Sir, can you take us back to the moment when you first realized you wanted to become a doctor, especially an ophthalmologist?
Being an ophthalmologist, it's a very late choice. Initially, what is there in the surrounding as a kid, that influences you. So either it has to be your family member being a doctor or somewhere close by like a family physician. So in my case, I didn't have much of any family doctor, but yes, we had a family physician who was very close and it really impacted me. Down the line, once you join MBBS and then you get in touch with different specialties, then yes, you develop your interest, you know exactly what you need to do, whether you want a surgical branch or medical branch. And ophthalmology gave me both the choices, like being a medicine physician at the same time being a surgeon. So slowly I really developed that interest. And at the same time, if you have any experience with a blind man, a blind person who lives his life or her life, like what difficulties he or she goes through, then you realize, yes, it's a really good job. Why not?
Wow, sir, that was inspiring. What are some of the misconceptions people have about eye health that you'd like to correct, especially among students?
Among students, yes, some people say keep doing some eye exercise and all, you would avoid numbers and all. Actually, it's not true. And second thing is people keep washing eyes with lots of outside elements like water, plain water. We suggest no, because there are lots of commensals and natural protectant layer on the eye which gets washed out. So that's not a very good habit, because you're rather contaminating your eyes with some outside things which you don't know actually it's pure or contaminant free. So these are the things, I think.
Thank you, sir. That was a great insight. Do our eyes reveal anything beyond vision, like stress, illness, or even emotion?
Emotions is all known, how eyes look in smiling and crying. But yes, eye can be known as a gateway to many systemic illnesses. Like take an example of diabetes. It does affect your eyes involving cataract and retinopathy. And many times people don't know until they have some kind of vision problem. Then you get checked and you see there was a diabetes which is causing this problem. Many things like hypertension, retinopathy, and many joinal arthritis. People have lots of joint pain and all. They come up with red eyes, inflamed eyes. So there are many examples actually where eyes really help us to know the disease.
That was amazing, sir. With AI, lasers, and robotics entering healthcare, what exciting advancements are shaping the future of eye care?
Honestly speaking, AI, robotics, and laser are not new to ophthalmology fraternity, because it's been more than 20 years. Take an example of LASIK. LASIK is a procedure where we have very robotic and very precise machine using AI for last more than 20 years to correct our glasses. Once you cross 18, before 18 you don't plan any LASIK surgery. Once you cross 18, you can plan your LASIK surgery, because your body is developed, your eye is developed, and your number is stable. Then we can remove the glass. We do it regularly. So there, everything is AI based. Like accuracy, the way eye tracker moves and guides you how to attack with the laser, and that doesn't fire until you have a aligned eye. So it's it's not new to our fraternity. Yes, nowadays things are getting commoner in common people life. So people are coming to know about AI and robotics and all. We are using it. Almost every equipment is having AI and inbuilt robotic technology. Without that, I think we don't have such an advanced fraternity if you compare with other specialties.
That was interesting, sir. Last but not the least, if students want to follow in your footsteps, what are the top 3 values or habits they should cultivate?
First thing, be friend with your books. I know there's no dearth of knowledge all around on internet and everything, but yes, need to be friends with books, because what books gives you a registration through lots of sensations and body, mind, and hands. Everything is skilled up and brain registers it. That is not there in online stuffs. That's so okay to get the references and all, but yes, you need to be friends with books. Secondly, you need to be patient. You cannot be like, okay, I'm done with and all. You need to be patient because it's a long duration of studies and all. And thirdly, not the least, but I would say perseverance. You may fall, you have to rise up again. You may fail again, you may have to come up again. So perseverance has to be there.
Wow, sir. I'm sure this will be a great help for us.
Thank you.
Now we have a fun segment called the rapid fire round
Okay.
to see the human side behind the doctor's quote. The first question, what is the first thing you do when you wake up?
Even a doctor is a normal human being. So same way we just get up, we thank that yes, you are alive. You do your routine, you prep up things, you do some regular exercises, prep up your kids for the school, and then get ready for your routine work, clinic.
Glasses, lenses, or LASIK?
Glasses up to the age of 18. And after 18, I would strongly say LASIK and no contact lenses. Contact lenses, we have seen deadly complications and lots of rules and regulations. And we have seen even getting transplant done because of eye lenses contaminating the cornea. And that is devastating. So it's good to go for LASIK, which is very advanced these days, and things are really very precise, and you don't have any such accurate surgery till date.
Your secret talent that most of your patients don't know about you?
If you talk of my fraternity, that I care for my patients a lot, and slowly it's not secret because they come to know, and that's why they develop faith in your practice. And apart from fraternity, I would say I love music. I tend to play some musical instruments like guitar, and I love some sports thing like swimming and many. I'm kind of a sports person, for that sake. Yeah.
If not an ophthalmologist, what would you have been?
Maybe some adventurous job like maybe wildlife or even a pilot.
Wow. Eye drops or eye exercises, which one do you prescribe?
I told you already, there are lots of misconceptions with eye exercises and all. Actually, in our whole body, there's no other muscle which is so active apart, like our eye muscles. Even during sleep, rapid eye movements, you must have heard of REM sleep. It keeps moving. The way this is exercising already, we don't need to exercise it much. So it's really not going to help unless some diseases are there, like lazy eyes, where we need to do some eye patching and eye movements to keep that eye, better. And yes, eye drops only for some particular purposes, some diseases, some illnesses, not unnecessary.
One message to everyone out there who think they cannot survive without phones or laptops.
You must listen to our story of right from childhood to now, where we have seen an era of no phones at all, then phones in one house in whole community. Then slowly things came up with mobile and then laptops and all. And as we are getting addicted to these gadgets, life is really getting more bored, I would say. We must go out, and you look at the studies and all, kids who are growing outside and indoor games. There are a lot of differences. Lots of high spectral corrections are required for indoor people who use a lot of gadgets. So I would strongly say, give some time off to gadgets and come out and get into the community and play a lot.
On a lighter note, a song that describes you.
एक रास्ता है जिंदगी जो थम गई तो कुछ नहीं.
Thank you, sir, for sharing not just your expertise, but your heart. You've reminded us that healing is not just science, it is service. To all our listeners, may you never take your vision for granted, and may you always strive to see the world with compassion and clarity. Until next time, stay curious and stay inspired.